How much is too much when writing progress notes? Am I writing enough to show that I'm providing really good care? Or am I writing too much and it might potentially harm my client? Hi, I'm Dr. Maelisa McCaffrey, founder of the free private practice paperwork crash course, and today I am going to share with you 5 questions that you can ask yourself to decide whether or not you're writing too much in your progress notes. The first question you want to ask yourself is this information I'm about to write down relevant or necessary for a diagnosis? So, for example, a certain type of symptom or the severity of a symptom, alcohol use, drug use, mitigating factors, all of those things could potentially impact whether or not you diagnose someone. So if it's information that will either support the diagnosis you've given or provide an explanation for why you might be changing or adjusting a diagnosis, or if it's information that supports not giving a certain diagnosis, then that is something you want to include in your progress note. The second question to ask yourself is this information clinically relevant to my ongoing work with this client? For example, maybe it's a significant event that occurred in your client's life, and it's going to change the course of your discussions and what you'll be working on together. Or maybe it's a new revelation they gave you or new information you didn't have before that will impact how you work together in the future. Now, these can be small things or big things. It doesn't really matter. What matters is that in your gut, do you know this is something that is likely to become relevant in your work together? If your answer is yes, or if your gut is telling you probably, then just go ahead and write it down. The third question to ask yourself is, would this information be important for another clinician to know if they needed to pick up work and start seeing my client next week? Another clinician can learn a lot of the nitty-gritty details from your client directly. They will have their own interactions with your client if they end up working with them, but it's much easier if they need to pick up immediate work with your client if they know things like what their diagnosis is, what you guys are working on together, what are common themes that come up, and anything else that you feel is relevant. So just think, if I were a clinician coming in to work with this client, brand new, what would I really need to know? What's the quick synopsis that you would give me? Any information that would be relevant to that synopsis should be in your progress notes. The fourth question to ask yourself when thinking about whether or not to add something into a progress note is this information fact? Was it observable? So are you potentially including just your interpretation of something that the client said, or a way in which you think they were reacting, or are you adding the actual fact? So for example, you could interpret that your client was sad about something, but the fact would be that they told you they were sad or made some other quote about it, or that they started crying or tearing up when they were talking about a particular topic. Facts and observations are really, really helpful in your progress notes because they're very difficult for anyone to dispute later on, and they usually draw a very good picture of what actually happened in your session. I especially see this a lot with anxiety symptoms because a lot of anxiety symptoms are kind of minute little behavioral movements that people do rather than something they actually tell you, but you can still verbalize or write down in your note what it is that you saw that you interpreted as anxiety. So that might be fidgeting, a shaking leg, a shaky voice, looking away, shifting eyes, whatever that might be. Just make sure you're focusing more on the observation and the facts rather than your interpretation of them when you're writing your progress notes. The fifth and final question to ask yourself when considering what's put in a progress note is, would a client quote actually be better for this? In my personal experience, I found that whenever I'm really struggling to convey what a client told me, and when I spend a lot of time trying to interpret what they said, it's actually much easier and more impactful if I just use the client's actual quote. Client quotes are a great way to really capture something that happened in a session or an insight that a client had without you needing to think about how to write something down. So I am all about using client quotes in your progress notes. So beyond all the basics of what to put in a note, things like your interventions, client presentation, your plan moving forward, client progress, these are the questions that you want to use to decipher whether or not I actually write something in the note or leave it out. And the most important thing to remember with any progress note is any note is better than no note. So use these questions to help yourself make that decision, write your note, and then move on with your day. If you still want more help with how to write progress notes, check out my online course, Documentation Made Easy. In that course, I walk you through all the details of what to put in a note. I give you examples, I give you sample files, I let you see how multiple notes play out over time for one particular client. You'll also get checklists and templates and all kinds of tools to make writing notes quick and easy. So click below for more information in the video description, and until then, happy writing.